Good afternoon, everyone. My name is Lehlogonolo POOPEDI, a social work lecturer from the University of Pretoria at the Department of Social Work and Criminology. I am going to be presenting on the use of virtual excursions and communities in first and second year social work practice modules. Now, the question might be, what is community work? Community work is identified as one of the three primary methods of social work intervention. It is also termed macro-level social work practice because it focuses on the community at large as opposed to just focusing on an individual or rather on a small group of people within the wider community. Now, looking at the definition, community work can be defined as the practice of professional social work with communities as the target population, or rather as the main setting for interventions that are devised by social work professionals. It also refers to the processes, helping acts, and skills that are used by social workers in order to bring about the required social change in the environment. In this instance, social work services are provided on behalf of and also to the benefit of communities as well as their members. Now, the benefits of this particular method of social work intervention go beyond a narrow ambit in that they directly contribute to the effective social functioning and towards improving the living conditions of the community and of society as a whole. The services that are rendered by social workers are community-centered because they are primarily informed and thus based on the needs of the community and further aimed towards the empowerment of community members. Community work further involves engaging in critical dialogues that are mainly concerned with shaping as well as amending services that are provided by social work professionals in response to the needs that are arising in communities. At our university, students in their first year of studying are exposed to community work by embarking on a few excursions to selected local social work organizations. Now, these excursions are primarily meant to give students a taste and feel of social work within a community setting. It is on these excursions where social work practitioners within the selected organizations orientate students to the organization with a specific focus on its mission and vision, the societal issues that it's addressing, the impact of the community development projects and social work services on the particular community within which these organizations are situated, the target population or service users of the organization, the services that are being rendered by the organization, and more specifically those that are being rendered by the social worker within the organization, the role of the social worker within that particular organization, and the social work values and principles that are at play within that particular social work service provider. Now, this is continued into their second year of studying, where students are further provided with opportunities to critically become aware of their context by embarking on frequent field trips into their own communities of origin. By doing this, students are able to gain critical awareness of their context and of various presenting issues within their communities. This could, for instance, include social, environmental, political, and other issues. This further enables students to engage in critical dialogues with community members and stakeholders to gain and further improve skills and techniques that are critical to engage with the wider community, to identify resources, services, and existing gaps in service delivery, to observe and learn what the community is doing about the identified issues. Now, all of these aspects form a very important foundation for critical dialogues and community work class activities. As we all know, the global COVID-19 pandemic emerged in the year 2020. Since the 5th of March in that year, the virus became an integral and very unfortunate part of our everyday lives in South Africa. Following this, the South African government imposed a strict and militarized national lockdown policy, as well as other measures in order to curb the spread of the virus. Citizens in this instance were prohibited from leaving their homes and quarantine, except for instances where they had to buy food, medicine, and perform labor that was considered as being essential during that time. Numerous aspects of life, including physical mobility, were also forced into confinement given the COVID-19 and national lockdown measures. All of this obviously had an impact on community work activities. What this particularly meant for our students in as far as community work was concerned was that there would be no contact classes, no community work activities or any form of community work engagement, no excursions, more especially on first year level, and no community visit or rather field trips on second year level. Given these circumstances, as well as the potential consequences that the COVID measures could have had on our students, we had to find innovative ways of bridging the gap so that our students were not further disadvantaged or even prohibited from getting any form of exposure to community work as a method of social work intervention. To achieve this, community work activities had to be implemented virtually. For first years, this was done through the use of virtual excursions. In this instance, instead of physically going to local selected social work organizations, arrangements were made with the social workers at these organizations to record videos, orientating students to the organization, with the focus still being on the earlier mentioned aspects. The video links were then shared with the students via the drive. This enabled them to thoroughly review the provided content and to further draft questions in their own time. Following this, the students were provided with another opportunity to synchronously interact and engage with the social workers via live Blackboard Collaborate sessions. This gave them a platform to ask questions and to also seek clarity when needed. On second year level, the gap was bridged through the establishment of fictitious virtual communities. These virtual communities were videos that were compiled by lecturers using both text and pictures with the aim of giving students an experience of being in the community, considering that they couldn't physically go due to the COVID-19 restrictions and measures. Names were allocated by lecturers to these specific virtual communities, and the context that was included in the video gave students an insight into the type of community it was, its demographics, and the type of resources that were available within that particular virtual community. Now, these virtual communities further reflected majority of the ills as well as injustices that are faced in real-life communities. This include but are not limited to gender-based violence, unemployment, substance use, and others. These virtual fictitious communities also reflected the measures that were being taken by the community members in order to address the identified issues as highlighted. The use of these fictitious virtual communities proved to be very beneficial for us because it formed the basis for critical dialogues and community work class discussions as well as activities. It further helped the students to understand their own communities because they could easily link what they would have previously observed in their own communities of origin to what they were seeing in the established virtual communities. Students could further draw comparisons by identifying differences and similarities in between the allocated virtual and their own communities of origin. This gave students a very good platform to also think of possible community work projects that they could implement in order to address the identified issues both in the virtual and in their own communities of origin. Based on the latter, new knowledge and awareness were developed from the critical dialogues that were primarily informed by the use of virtual communities. As much as the pandemic was mostly negative, it created various opportunities for us as institutes of higher learning to readdress, adapt, and transform teaching and learning pedagogy in order to successfully deliver established academic programs and curriculum under different circumstances. In the case of our social work students, similarly to physically visiting both social work organizations and real-life communities, students were still able to develop a good understanding of communities and community work as a method of social work intervention through the use of both virtual excursions and communities. In conclusion, what we are taking from this is that COVID-19 cannot stop community work, and that despite the COVID-19 crisis, we still had the same opportunity for learning as we did before, but were rather challenged to look in different places in order to find it. What we have also learned is that going forward, we as institutes of higher learning should actively seek innovative ways and new ways of implementing community work activities should we experience a different or rather a similar kind of a disaster to COVID-19 in the future. These are the sources that I consulted when putting together this presentation. Now, this brings me to the end of my presentation on the use of virtual excursions and communities on first and second year social work practice modules at the University of Pretoria. Thank you all.